Hello, I'm Dr. Steve Taylor. I'm the lead consultant for the Birmingham Heartlands HIV service. I'm speaking to you because December the 1st is World AIDS Day, and we are trying to encourage HIV testing across all sectors of healthcare, from GPs, practice nurses and hospital doctors. Some facts. 1 in 3 people who are living with HIV in the UK do not know that they're HIV infected. 1 in 3 people who are diagnosed by hospital services are diagnosed late. 1/3 of people who die from HIV/AIDS related illnesses die because they present to hospital services too late for effective treatment. The treatment for HIV is now extremely effective if you're diagnosed early, and life expectancy can be in excess of 30 years. We can prevent mother-to-child transmission down to levels less than 1% if mothers are tested in pregnancy and we give them effective treatment. There are no restrictions on mortgages or health insurance from having a negative HIV test. For all of these reasons, HIV testing has to be back in the mainstream of healthcare. It should not be something that only specialists can do. It should not be something that you need extensive counselling for. All you need to say to the patient is, we're doing a routine set of blood tests, of which HIV will be one of them. If you do get a positive result, then health advisors will be with you within the same day to help break the news, and the patient will be seen in the HIV clinic within 24 hours. The prognosis when diagnosed early is excellent. So I think that we need to be selling the uptake of HIV testing, and we need to be moving away from this HIV exceptionalism. So if you're wondering, who should I be testing, then think about the clinical indicator diseases. And what follows are 3 slides just demonstrating the kind of conditions which should prompt people to offer an HIV test. Looking at the first slide, here we can see common respiratory symptoms which should prompt HIV testing, such as tuberculosis, recurrent bacterial pneumonias. Then we have neurological conditions such as Guillain-Barré syndrome, unexplained dementia. Dermatological conditions are a very common presentation for early HIV, so recurrent seborrheic dermatitis, outbreaks of psoriasis and herpes zoster infections. Turning to gastroenterology, then patients with chronic diarrhea should be considered for HIV testing. All patients with hepatitis B and hepatitis C should be HIV tested. Unexplained weight loss should raise the question of HIV, and a test should be offered. In gynecology, cervical cancer is far more common than we see in the general population, especially as well as seeing changes on cervical smears. In oncology, all patients with lymphomas should be tested for HIV, and most cancers are more common amongst people with HIV. Within haematology, thrombocytopenia, HIV is now the #1 cause of this condition in the United States. Anybody presenting with low white cell counts or low neutrophil counts should also be considered for HIV testing. And finally, you can pyrexias of unknown origins, and anybody with a sexually transmitted infection should have an HIV test. The list of these conditions is available as an attachment with this podcast, so all specialties have access to them. So what we're trying to do is really expand the number of patients who are going to be offered HIV testing, and hopefully therefore saving many more lives than we currently are. Thank you.